Good afternoon, this is Media Center Ukraine Odesa, and we continue for today. You can watch us online, both on our Facebook page and on our YouTube channel. If you have any questions, or if you want to express your opinion, you can do this through the messengers you can now see on your screens. At the moment, and now we are going to discuss the rehabilitation to war victims in Odesa region. Our speakers is Oleh Sokolov, Odesa representative of the Government Commissioner for the Rights of Persons with Disabilities, Mykola Storozhuk, Minister of Veterans Affairs of Ukraine, Odesa representative, Oleksandr Selezniov, CEO of Prostranstvo group of companies, and Olha Yushkovska, head of the Department of Sports Medicine, Physical Rehabilitation and Physical Education of this National Medical University. We were supposed to have with us Oleksandr Kurmyshov, the head of the Department of Health of the Odesa Regional State Administration, but unfortunately he cannot participate today. There was a conference to discuss the challenges and future plans for rehabilitation. I expect that there have been some conclusions drafted. Let's start with Oleh Sokolov. As for the results, I think that we should give floor to Olha Yushkovska. Okay. Thank you. Yes, really. Last week, Odesa saw a very important event. This is the first conference where the experts and stakeholders were able to join their efforts, including the representatives of local authorities, businesses, NGOs, educational institutions, the healthcare institutions. So there were a lot of important participants that got together to discuss the challenges for rehabilitation in the south of Ukraine, to consolidate efforts of all experts and stakeholders to find the ways of improvement, and also to speak about a roadmap for the future. We consolidate our efforts in 3 areas. Firstly, is rehabilitation in healthcare institutions, both private and public. Secondly, to train professionals. This is a very big problem at the moment because in Ukraine the current rehabilitation system is undergoing reforms. There are new jobs, there is new multidisciplinary approach to train doctors, physical therapists, the therapists of language. Now, this is a cornerstone that should become our focus, to organize properly rehabilitation. And thirdly, is to organize barrier-free environment, inclusive environment, because we understand that the amount of persons with disabilities is already quite large, but it will only increase because of the Russia's aggression in our country. That's why it is very important. And when it comes to barrier-free and inclusive environment, we have been actively developing adaptive sport and physical culture. So this makes possible to provide rehabilitation services to people through sport, both in the city and in the region, in rehabilitation centers, and also outdoors. Different sport pages. During the conference, the stakeholders made their presentations. We also systematized this problem, and now we are at the stage of aggregating the results. There has been prepared the resolution of the conference, and in the nearest future we are planning to publish it. We are also preparing different official letters to public authorities, and we as teacher, and I'm a teacher because I'm the head of the Department of Sports Medicine, Physical Rehabilitation and Physical Education at the Odesa National Medical University, and we are going to train and teach our students according to the current challenges. Thank you, Mykola. As for the results of the conference, Olga has mentioned that you are going to publish a resolution. And what is your way forward? It has been also mentioned that you're going to address different authorities and institutions. Do you expect to get effective response from those bodies? Yes, that conference was really very important, and we all are aware of the syndrome of Afghanistan, of Vietnam, but the hostilities back then were not that intensive as now, because the Russia-Ukraine war is intensive in several times than it was in the past. That's why we need a professional approach. And we also need to organize medical and psychological rehabilitation. We know the experience of the United States, of Croatia. And a small example, in the United States, they have the Ministry on Veteran Affairs, and it has a department for medical affairs. Under its umbrella, there are more than 150,000 hospitals, different clinics, and outpatient institutions. We also need the same rehabilitation centers for physical and mental rehabilitation. I want to say that last year we had kind of a tandem. The Center of the Recovery Medicine in Nedelina Street and the State Bodyguard Service Sanatorium Arcadia. Memorandums were signed for efficient mental and physical rehabilitation with the involvement of the whole family, and this is very important. And there are positive feedbacks, and we want to develop activities in this area. I have prepared an official letter in the name of the head of Odessa Regional Military Administration and the head of the Odessa Regional Council. In this letter, I say that we need a veteran space with the facilities for mental, physical rehabilitation, for sport, for children's room, and a range of other facilities for veterans to stay there, to communicate with each other, and to find the way together as peers. And I think that we need to develop this. There is no such space in Odessa. There is a veteran hub. Yes, there is a veteran hub under the umbrella of the Southern Ukrainian University, but they don't have their own. We don't have their own hub. They don't have their premises. They just rent a facility, and which is not in line with the modern requirements, like they have in Rivne or Mykola. Thank you, Oleh. Good afternoon. I would like to welcome everyone, and I'd like to say that we need to understand, and this has been said by Mykola Storozhuk, that there are several rehabilitation centers, but we need to check their accessibility. What is meant by rehabilitation? We want to get to centers and to be independent there throughout rehabilitation, to have accessible water closet facilities, to have everything needed for people on wheelchair, with prostheses, people using crutches. to have a ramp there. I'm an instructor of the active rehabilitation, and I work in the Western Rehabilitation Center. I work with our military who participated in the Game of Invincibles in Düsseldorf, and I help them, I train them. And when you get to a rehabilitation center, there are no barriers for you. This is an inclusive, barrier-free environment. Yeah. And this is the rehabilitation center that they have, like for Invictus Games, and this is they have the Braille alphabet for all people with the sight problems, with the with their hearing impairments. They are psychologists, they are ergotherapists, and they have been working since 2014 when the war started. And a lot of soldiers have visited the center, and I would like to have in Odesa the same efficient rehabilitation center for people to visit us, to be here, because the war will be over with our victory. And what is Odesa? What is the Odesa region? We have the Black Sea, and we should have inclusive beaches, and rehabilitation centers should be efficient and should be inclusive for people. And of course, we need high quality equipment, we need strong professionals, and I know that Olga has been working on this to train, to teach new young professionals, and I understand that we have the problem with professionals. I think that yes, at this stage. And I want to say that, first of all, we need to have people on the wheelchair who can give advice to our military. How to select the proper wheelchair, to tell more about prosthesis factories for our soldiers to have a choice to select the best one at a specific stage. Mykola has already noted that there is an official letter prepared for the head of Odessa Regional Military Administration and the head of the Regional Council to establish such a center. Do you have a preliminary estimate of such center? No, we don't have, but when it comes to the Rehabilitation Recovery Center, this could be used as an example of an exclusive space. But the calculation should be done by specialists. There should be a building, accessible building, barrier-free building with additional facilities, and to have here those servicemen and service women, not only from the city but from the whole region. And I think that you should better look for business representatives, for philanthropists. And yes, you are proactive, because we know that if the government fails, if local authorities fail, then we could do differently. And we discussed that with Oleksandr, that we want to cooperate with them or ask them to ensure the proper rehabilitation center. I have a question to Oleksandr Selezniov as a business representative. How can you help to implement such a project? And luckily, we started long ago, almost 20 years ago, to scrutinize the recovery and rehabilitation medicine, and we have Prostranstvo health. This means that people at their place of residence to give possibilities to have everything needed to improve their health. And so the full-scale invasion started, and now we understand that we need to just restructure it for our veterans. We are going to open such centers in the future. And for us, the conference was very important to involve sport clubs. And now we have 2 sport clubs that are ready to be actively involved in rehabilitation for people with disabilities. And so we can support them with equipment partially and with the professionals, and we will be happy to do that. And in cooperation with local authorities, we know how to do this. And if there are premises, we'll be able to adjust them. And if these are public premises, if there's some private ownership, then we will act accordingly. Everything depends on the premises and the types of activities they will host. I would also like to speak about 2-3 important areas that we announced during the conference. This is psychological, especially social rehabilitation, because we have worked with more than 200 heavily injured soldiers. They have been rehabilitated, and it is very important to understand the answer to the question, why they need that. And they were internally motivated because they wanted to come back to the front line, to their comrades, their brothers in arms, their sisters in arms. And for others, it is very important to understand how the attitude of the society to them. And there are a lot of studies about veterans, about the fact that the society is afraid that veterans are dangerous because they can be drug addicted or alcohol addicted or abuse some other substances, and there is the Afghanistan syndrome. And we need to explain this everything. And HR of big companies are ready to hire veterans, and the first 5 people work at our company. So we just want to learn our lessons and then to scale up this experience for other big companies. And for people who undergo rehabilitation to be hired further on with regard to their mental and physical state. And the state is not ready now because there are some specific norms and standards, and businesses usually organize new types of activities. And this is our HR activities with regard to people with disabilities. The same could be said about the physical rehabilitation, and we are also getting ready to have just small mobile teams for diagnosis at combat zones to find people who are in more need of medical services for recovery. At the moment, what is the maximum amount of veterans you can support? We have our ProMed Center that provides for physical, psychological, and psychiatric rehabilitation. We provide services free of charge. We don't have any money-raising campaigns. No budget is involved, but this is not important. And as for physical rehabilitation, following the results of physical rehabilitation, we can help them with the employment. We also planned to help them with the accommodation, but this is optional. This is a bit more difficult. Oleh, center has been mentioned. Is it in line with the requirements that you talked about? And I would like to ask about ProMed Center. Is there inpatient care? No, unfortunately not. So what are we discussing here then? So it would be great if I can visit it. If it's possible, can you please invite me for me to see personally? as far as I understand, that a person should be there during a specific period of time for rehabilitation. The person just should have enough time for rehabilitation, and for that people should stay there. There should be an inpatient care. And as far as I understand, that there could be different classes, like an hour and a half each. And as far as I understand, we need other types of facilities providing for inpatient care, for people not to rush somewhere, but to calmly stay there, because this is about rehabilitation. People should live there. So it should be a kind of a resort, a sanatorium. They should work with psychologists or other doctors. The course is for 1 month for veterans, and you are perfectly right. And what you say now, it is called hospital, but as for rehabilitation, they come to us because only we have such equipment and professionals, or there are not so many places there. And the head of the healthcare department says that we need 500 beds for rehabilitation for the whole region. We don't understand how they are going to do this, how much time will it take. And this is not only about premises, equipment, but also people. And I think that if they have at least 50 beds and if they will provide inpatient care, that will be enough. If we can have 100, then it would be great, because 500 is a big number of beds. If you allow, as for the rehabilitation system in Ukraine, and of course, all speakers are right. But what we should understand, at the moment, the rehabilitation system in Ukraine undergoes active changes, because we try to build now the system that well-developed European countries have. And this envisages specific stages of rehabilitation intervention. There is acute rehabilitation that takes place in hospitals. We don't wait for different problems arise related to the lack of activities with the hyperdynamics. And this is acute rehabilitation, hospital. The next stage, subacute rehabilitation, when a person is not in a hospital, a person could be in a sanatorium, so this is a long-term rehabilitation. What is important to understand here? A person with disability cannot be a patient the whole their life. So such people can stay for some period of time in rehabilitation centers and hospitals, but when a person comes back to ordinary life, such persons with disability should not feel themselves the object of unequal attitude. So what we try to explain here, that the goal of the rehabilitation is not to ensure the full recovery, because we have a lot of veterans with these amputations. Some of them have vision impairment and etc. and or hard of hearing person. But the goal of rehabilitation is to decrease the limitations, to improve functioning. And this is what we are talking about. We want to teach a person to deal with their life on their own, to provide such persons possibility to be socially independent. Why do we say that there is such a huge shortage of professionals? Because we are still forming the rehabilitation systems. And so we had our Soviet heritage, they are not the doctors of functional physical culture and etc. According to the law of Ukraine, their new just jobs, like doctors of physical mental rehabilitation, and such doctors should work in a team. And the shortage of professionals is because we need to establish multidisciplinary brigades with physical therapists, with language therapists, prosthetic specialists, assistants of the physical therapists, ergotherapists, and their doctor, their supervisor. And we should not train only one type of professionals, but the whole brigade, the whole team. And if a healthcare institution has such a team, then the National Healthcare Service can conclude an agreement with such an institution and to allocate funds for rehabilitation in such an institution. It's not only about massage or different types of showers, because rehabilitation encompasses different types of exercises and other tools, and the exercises are prescribed individually. And the task of rehabilitation is functional independence. That's why we have different types of rehabilitation and different types of facilities. When it comes to special centers where veterans can stay, and for 14 or 21 days for rehabilitation, and with the meals provided and their exercises, and this is great. But when it comes to outpatient rehabilitation, as it is organized in Pramed Center, envisages that veterans can come to the center every day and to train, to do exercises under the supervision of different professionals. And in our era, equipment is very important because there are evidence proving their efficiency. And the more such highly specialized centers we have for our patients, the higher the rehabilitation potential of the region is. And Mykola asks to take the floor. Unfortunately, the National Healthcare Service of Ukraine sees and does not see veterans separately. They're only citizens of Ukraine. I have raised such issues several times, and we need a special package of services for veterans of the war. The package for medical and for physical and mental rehabilitation. Only this year, they have introduced the package for rehabilitation of children and adults in inpatient and outpatient institutions. And let's look at the funds provided for healthcare institutions. When it's outpatient care, 14 days, 10,800 hryvnias. For inpatient care, for up to 20,000 hryvnias. And it could be two complexes of rehabilitations for 40 days. They are NGOs, volunteer organizations, and they started sending letters to the National Healthcare Service that this money is not enough. And now we can see some changes. They are the categories of the severe brain and spine injuries, up to cycles for rehabilitation, but the payment is at the level of 33,000 hryvnias, regardless of whether there are 2 or 8 cycles. And I've also talked about that during the conference, and I also referred to the representatives of the National Healthcare Service. We need a separate package for medical services for veterans of war. In Decree 1464, there is a package which is the readiness of healthcare institutions to provide provide health care in emergency situations. And the global rate is more than 1 million hryvnias. Why can't they introduce the same package to provide physical and mental services for rehabilitation of veterans of the war? You've mentioned centers in Rivne and Mykolaiv. Do they meet your requirements? What you see there, like the ideal situation? They are approximated. Ideally, they also need to have a cafe, and they also need to provide services, advice. But the state will not be able to do this because of the limitations of treatment, including mental support, mental rehabilitation, covering all cycles. Yes, we have hospitals 10, 11, 1, and there is a requirement to have mental departments. But these departments will be the part of these institutions. But ideally, we need to have separate hospitals, clinics, and where the peer-to-peer relations for veterans and also the support of veterans, as they have in the United States. You see that the state will not be able to do this, but you've addressed anyway, Mr. Keeper. But I think that we are discussing like different things here. I understand Oleh and Mykola, what they want to have ideally, some big premises having everything, and you cover some other things. Yes, really, and there is a huge number of issues. That's why we created NGO, the Association of Rehabilitation Management. And in the framework of the association, we involve in our activities rehabilitation institutions, hospitals, their healthcare professionals, and also businesses. We have established for us a very important goal to consolidate all the efforts and to aim them at the following output. To have in the south of Ukraine, maybe not an ideal, but next to ideal model, because we understand all the needs. We understand that this is a difficult path, but it is also very important, and we need to work step by step to achieve result. And this is great that in our team we have, like me, because I'm the teacher and rehabilitation specialist, they are practitioners, doctors who understand all the challenges. They are representatives of veterans. They are persons with disability. These are the people working within the inverse sport, because we have been actively developing adaptive sport or adaptation sport, and someone should just be in charge of that, not to have some separate centers. And it is very important to develop the whole system, and we want to develop such a system. Just for it not to be scattered, to have everything at one place. And I would like to wish you to achieve your result as soon as possible, not to have such challenges anymore, because this is the 10th year of the war and the 2 years of this full-scale invasion. Thank you for joining us today, and this is the last briefing for today.